All right. We're going to get started here, but at first I'd like to introduce myself and my team members here. My name is Johnny DeVito with IXSolutions. Is that a little better? My name is Johnny DeVito with IXSolutions. Thank you everyone for coming today, even though the weather's not so nice. We appreciate your attendance and hope that you can get some good benefit out of the presentation that Larry's about to give here. Along with me today is Franklin Parker, another member of our Medicare team, as well as Grace Hare. Larry Cassman here is going to be presenting. Real quick, just wanted to make note that IXSolutions is the benefits broker for the Chicago Bar Association, and we also do a number of different additional lines of insurance coverage for CBA members. One of the new lines of insurance coverage that we now can offer to members at a discounted rate is MetLife Auto and Home Insurance, which is the flyer that was sitting on the table there when everyone walked in. So if you have any additional questions after that, we'd be happy to talk to you about it and help you out on that front. But with that being said here, I'm going to turn it over to Grace to touch on a couple of housekeeping notes here before Larry jumps into it.
Hi, everyone. So this is being recorded via live webcast, and I will be emailing all of you following the presentation with the recording as well as a copy of the slides with all the information on today's presentation. If you do have questions throughout, make a note of them, and Larry will be pausing multiple times throughout the presentation to take your questions. We ask if you either say them very loud or go up to the mic and say them. Larry will repeat the question and then address them since this is being recorded. As Johnny mentioned, the four of us will be staying afterwards to address any individual questions you guys have. So I think at this moment, enjoy and thank you again.
Thank you all for attending. I know it's not a great day, but we really appreciate you coming out. Yes? Louder? Okay. Maybe I'll just hold it. Might be better. So Medicare is more confusing than it should be. We're here to make it simple. We'll do the basics of Medicare, the ABCDs of Medicare, of if you should apply for Medicare, when and how to apply for Medicare. This is not only for you, but it's for your spouses, your family member, your friends, and even your clients. There's a lot of questions. A lot of times there's not that many people you could turn to. Is it Medicare? Do you call an insurance carrier? That's what we come in. We are certified. Every year we do at least 20 hours of certification for Medicare, so we know the ins and outs and what you should do. If you're on an employer group plan, we'll cover that as well. If you should go on Medicare or not, in some instances you don't have to. So we'll get started. So the history of Medicare. In 1945, President Truman first introduced it, but it was not signed into law until 20 years later by President Johnson. And the first person to receive Medicare was President Truman. He waited 20 years. He's probably, speed it up a little bit. I'd like to get a little bit sooner. And that's all there was, Medicare Part A and B. A, hospital, B is doctor. Then in 1997, they said, well, there's a need for more than just Medicare. There's some gaps because you could pay, and then there's some out-of-pocket costs that it could be unlimited out-of-pocket. So then they came out with the Medicare and Choice plans that started with the Balanced Budget Act in 1997, which were Medicare supplements, and a few of them covered Part D drug plans as well. And they came out with what's called Medicare Advantage plans that are still in force that cover doctors, hospitals, and prescription drugs. Then they introduced adding a standalone drug benefit in 2006. So if you get a Medicare supplement with one carrier, you may have your Part D or your Medicare drug plan with another carrier. And that actually helped a lot of people save money because the drug plan that was associated with that Medicare supplement might not be the best plan, even though Medicare supplement was pretty good, but not necessarily the drug portion of it. So who is eligible for Medicare? Medicare is health insurance for those who are 65 or older, or persons who are deemed Social Security disabled for 24 consecutive months, and then in the 25th month, they are automatically put on Medicare Part A and B. And what is CMS? CMS is the Center for Medicare and Medicaid Services. They govern the actions of Medicare, Medicaid, Medicare Advantage, Part D drug programs, and children's health insurance programs. It says most, but all marketing materials must be approved by CMS, like this presentation, and the main focus is to protect those who are eligible for Medicare. So how does Medicare work? Through your payroll taxes, you've been paying 3% towards Medicare. If you see it on your check stub, that's where the money is going. It goes to the government. Once you become Medicare eligible, Medicare takes control of that money, and then when you have a claim for Medicare Part A or B, they will pay the portion of that claim for you. These two words get confused quite often, Medicare versus Medicaid. Medicare is health care. Medicaid is financial aid for health care, and you could be any age to qualify for Medicaid. And Medicaid is through the Illinois Department of Health and Family Services. That's the state agency that administers Medicaid for Illinois, and you apply at your local Health and Human Services office. And for more information about that, you can go to medicare.gov. So there's 4 parts of Medicare, A, B, C, and D. A is hospital coverage, B is medical or doctor coverage, C is what's called a Medicare Advantage plan, and then Part D is a prescription drug coverage. Some of the things that are covered under Medicare Part A: inpatient hospital stays, skilled nursing facility services, home health care, and hospice care. Coverage for 2020. Once you go into the hospital, Medicare pays everything for the first 60 days except a $1,420 deductible. This year, for 2019, it was $1,364. After you pay that deductible, if you just have Medicare Part A, the Medicare will pay everything else for the first 60 days. If you have extended stays in the hospital from 61 to 90 days, Medicare will pay everything except $341 a day. Days 91 to 150, Medicare will pay everything except $682 a day. And after days 151, you would have to pay 100%. As you can see, this can add up to be quite a bit of money. Part B, medical coverage, also known as doctor coverage. It covers doctor services, supplies, diagnostic tests, outpatient mental health, outpatient therapy, some preventive services, emergency services, ambulance services, any medication, injectable chemotherapy that's done in a facility or a doctor's office is covered under Medicare Part B. Part B also has a premium and a deductible. Let me go back to Medicare Part A. As long as you have worked 10 full years or 40 quarters, there is no premium or cost for Medicare Part A. To continue the benefits of Medicare Part B, coverage for Medicare approved amounts. Medicare pays 80% of approved charges, and then you would be responsible for paying the 20%. There's a monthly premium. It's based on income, and I will have a chart to showing what the income and what those premiums will be. And then there's also a per calendar deductible for Medicare Part B. So for 2020, the Part B premium is $197 per month for new beneficiaries starting in 2020. It was $135.50 for anybody who qualified for 2019. That's where it starts, and it could go higher based on income. If you are collecting Social Security, because you can start collecting Social Security at age 62, they will deduct those premiums from your Social Security check. Otherwise, you will be sent a 3-month bill to pay for Medicare Part B premium. The state Medicaid, if you qualify financially, they could help pay for your Part B premium. They could pay for all of it or a portion of it. You can't just sign up for Medicare Part B whenever you want. You have to have a qualifying event. There's a 10% penalty for every year you do not enroll in Medicare Part B. That doesn't come up too often because usually when somebody turns 65, they have Medicare Part A. They don't have Part B because they're covered under an employer group plan. If it's over 20 lives, you don't need Medicare Part B. But for some people under 20 lives, Medicare is the primary, and that's very confusing. But But in that situation, if you don't have Medicare Part B and you need it, you could enroll in Medicare Part B throughout the year, and you don't need the qualifying event is that you have credible insurance coverage. But for some reason, some people might have Medicare Part A and B, and they think that's enough insurance, not realizing, but Part B is their doctor portion. They don't have it. If they go to the Social Security office to apply for Part B, they'll say, well, you can't do it right now. You have to enroll from January 1st to March 31st for July 1st effective date. Here's the Part B. Any questions so far? Okay. Here's the Part B premium for 2020 is all the way on the right. The other years, 18 and 19, are there as well. So actually, I think before it showed a premium of $197. I think that was the deductible. The premium for Part B is $144.30. Is it hard to read? Yeah. Okay. So the column all the way on the right, it will show if you're a single taxpayer, and then if you're married, the income rate's just double. But if you're a married couple earning $170,000 or less, your premium will be $144.30. And then there's different income brackets, and your premium for Part B goes up as well. And it could be as high as $460.50 for a married couple earning more than $750,000, or for a single person earning more than $500,000. You had a question?
I have an Irma question. The difficulty is they go back and look at income that is 2 years old.
2 years, correct.
And so they're often looking at full salary when you're not eligible for it, and they're basing a higher rate on that full salary, even though you're now eligible and your salary has gone down. I have appealed that, and I won. Does anybody know if that is? I don't know if I just had a bad rep and she didn't pay attention, but she waived it. But do you have any comment on that?
It's Social Security who determines that. They automatically go to the Internal Revenue Service, and they look at 2 years tax returns, and that's what they base it on. So if you are paying a higher premium and you don't think you deserve it, maybe they're reading your income tax incorrectly, yes, I would try to appeal it if you can.
I didn't challenge it saying I wasn't eligible when I earned this income. Now I don't earn that income, and they bought it. I don't know if
Okay. Yeah, it has to be approved by Social Security, so you probably did a great job. But also, if you do retire and your income does go down, this is the one thing the government does very well. People who've been retired for a few years and their income goes down, all of a sudden they see a reduction in their Part B premium. It's done automatically. You don't have to fight after 5 years and say, hey, my income went down. Could you lower my Part B premium? That is done automatically. So, yes.
What if you're married and you file singly and you're 65 and your spouse is under 65? You can charge a single rate or married for Part B?
Well, it's based on your tax return.
Larry, repeat the question. You file singly, then you just...
So the question is if you're married but you file separate tax returns, correct?
Correct.
It's not a household income. It will go by your tax return. Does that answer your question? So we'll go by, if let's say you're Medicare eligible, your spouse is not, and you file separate tax returns, they'll look at your tax return because the Part B premium is per person. And if you only file your own tax return and not a joint tax return, they're just looking at yours. They're not combining your spouses.
That person would be charged for the single column that's on your side.
Correct. Right. Right. Oh, it's not there. Yeah, single column. Right. Any other questions? So there's a need to have more than just Medicare Part A and B because your out-of-pocket could be unlimited. Medicare supplements in Illinois, especially in the Chicago metro area, are the more popular plans. The rest of the country, it's a little bit different. Your network is Medicare, which is the largest network there is. There is something called Medicare Advantage plans that I'll get into as well. They're not as popular because when you get a Medicare Advantage plan, they actually pay less to the provider, so the hospitals around here don't want to accept them, especially the major ones. With a Medicare supplement, they cover the gaps, such as they have Part A deductible and a Part B deductible, coinsurance, and then there's excess charge over Medicare, and there's travel outside the United States. Once a doctor accepts Medicare, they are able to charge an extra 15% more. And these plans, the Medicare supplement, will cover those. So if a doctor accepts Medicare and Medicare pays him $100, he has to accept that, and he can charge you 15% more. He cannot charge you an extra $100 and expect you to pay. That's called balanced billing, which he cannot do if he accepts Medicare. Medicare itself does not cover if you travel outside the United States. The Medicare supplements do up to a $50,000 lifetime, which is not enough. There's a great plan out there. There's a few great plans out there. It's called travel health insurance. Blue Cross has one. It's called Geo Blue. Doesn't matter what your age is. You just put in how long you want to you're going to travel for. As an example, me and my wife, we were 62 at the time. We traveled for a week. It was a total of $95. It gave us, they paid first. The travel health insurance paid first. It covered up to $1 million. And it would pay the provider directly to that country. Even if you're on a group plan right now and you're overseas and you need medical attention, if you go to another country, they may want you to give them a credit card before they do anything to you. This happens a lot. You could prepay, and then when you come back to the United States, you would have to fill out a claim form with your insurance carrier to get reimbursed, and they will convert it to US dollars. I think the easiest and safest thing to do is get travel health insurance. It's worked quite well. For Medicare supplements, there's 10 basic plans, A through N, but really the only plans that sell are a Plan F, which is the most comprehensive, a high deductible F, a Plan G, and a Plan N. There's really only 4, and I'll talk about Plan F in a minute because that's going away for newly eligible Medicare people in 2020. The premiums, you choose the carrier, and the premiums can vary, but these are standardized plans. A Plan F is a Plan F no matter who the carrier is. Enrollment is guaranteed if you enroll within 6 months of getting Medicare Part B. You can pick any carrier, any plan, it's a guaranteed issue. After 6 months, some carriers may underwrite and they could decline you or charge you a higher rate. Blue Cross Blue Shield is always a guaranteed issue. They never ask medical questions, so their premiums are slightly higher because of that. If you have an employer plan and you have Medicare Part A and Part B, you are a guaranteed issue when you leave that employer up to 2 months. You could pick a plan. And underwriting, if you wait more than 2 months, they could ask medical questions and you could be declined as well. Yes? Well, yes, you have 2 months to go to any carrier you want, guaranteed, as long as you have Medicare. You need Medicare Part A and B. So sometimes if you're working for an employer that has more than 20 employees, you may not have Medicare Part B. It might not be necessary. The first thing you should do, if you know ahead of time that your spouse or yourself is going to retire, a couple months before, enroll in Medicare Part B. But let's say you have both Medicare Part A and B. You have 2 months to go to any carrier and any plan with a guaranteed issue, which means no medical questions.
What I'm saying is if you're already covered by the group plan, do you have to do anything at 65 or 3 months before or 3 months after?
Okay, yeah, I'm going to get to that if you should enroll in Medicare Part A and B. So the question was, if you are covered under an employer group plan, do I need to get Medicare Part A and B? And that question comes up a lot, and I'll be covering that in a couple slides. Which plan is best for you? Plan F is the most comprehensive plan. It's the best-selling plan over the last few years. But Plan F will not be offered in 2019. With Plan F, whatever the premium was, that's all you had to pay. There was no copays, deductibles, or things like that. The reason it's going away, it's called macro. It's tied to the ACA in 2014 stating that by 2020 there cannot be a plan that pays a first dollar benefit. As you remember, Part B has a deductible. The Plan F pays for that. Now the most popular plan will be a Plan G. Now The Plan G is a better cost option. The only difference is, I believe it was $194 deductible for Part B going forward in 2020. You will have to pay that $194, and then your doctor's coverage after that will be covered at no cost to you. But the difference in premium between a Plan F and a Plan G will be more than that Part B deductible. So a lot of people are saying right now, I want Plan F. I always want Plan F. Are they taking it away? If you're Medicare eligible before January 1st, 2020, you can always get a Plan F, but really it wouldn't make sense. You're spending more than you should because you'll save more than the $194 deductible, the difference in premium between an F and a G. Yes, do you have a question?
Does the Plan G pay the doctors at the same rate as the
Yes.
Plan F did?
Yes, they do. The only, so the question was, does the Plan G pay the doctors at the same rate? There's a negotiated rate for doctors, and that's what it is. Plan F, you can see the doctor as many times as you want. It covers that calendar deductibles resets every January 1st. It paid that Part B deductible. Plan G, Medicare will pay after you pay that deductible. So you might need 2 doctor's visits to pay towards that deductible, and then after that, it will be no doctor charge for that. And the other reason that Plan F is going away, some feel that people are seeing the doctor more than they should because they realize they have a free doctor visit. So they're going for every little thing, and it's costing Medicare quite a bit of money. So now there's 2 sides of that. Can people afford to pay that deductible first? Will they not go to the doctor when they should? So there's disagreement if it's going to help or hurt, but Medicare feels that maybe people will think twice by going to the doctor, but some people might struggle to come up with that deductible, even though they'll save more throughout the year than what that Part B deductible is. The other plan that's very popular is something called a Plan N. Now, Plan N is similar to Plan G. The only difference is with the Plan G, once you pay that deductible, you don't have any co-pays when you see your doctor. Plan N, you will have a $20 copay. But in most cases, you're saving about $40 a month, which means you would have to go to the doctor twice a month for it not to be a good deal. Another thing to consider is when you have a plan, let's say you have you're with a carrier, let's say Blue Cross as an example, because Blue Cross is a guaranteed issue. They don't ask medical questions. You could change plans every single month if you want to. They won't publicize that. So if you're healthy, you don't see a doctor that often, a Plan N might make the most sense. Saving over $40 a month compared to Plan G might make sense. Other carriers, if you want to switch, may require underwriting, so you might get decline. But your fallback is to go with a carrier that has a guaranteed issue like Blue Cross does. My favorite plan is the least costly. It's the lowest premium. It's called a high deductible F. Next year it will be called the high deductible G. There was a statistic saying people who turn 65 may have a hospital stay once every 7 years. Off the top of my head, I think the premium for a Plan F right now for a male was $170. For a high deductible F, it was $50. So it's a difference of $120. But as you get older, and I think the break even is at age 78, how the high deductible F works is you would pay 20% of all your medical costs until you reach $2,300 out of your pocket. The thing with when I talk to people, especially who are in their 80s or 90s, they bought a Plan F and they never got rid of it. You should always look to see if you're on the best plan that's best for you. At age 78, you would save about $2,800 in premium from an F to a high F, and your worst case scenario is $2,300 that you would have to pay out. That's in your worst case scenario. So that means, in the worst case scenario, you're saving $500 by getting a high deductible F. So it's something to consider. And whenever you have questions, a lot of people like just to keep what they have. Call us. We'll tell you if that's the best thing to do. But we have one gentleman in particular, when he turned 65, he got the high deductible F. Sure enough, a year later, he says, Larry, can I switch to an F? I said, why? Because I'm having hip surgery, and I don't want to pay the $2,300 out of my pocket. I'd rather pay the higher premium for a few months. Sure enough, after his rehab, he went back to the high deductible F. I mean, saving money. Did you have a question, sir?
Yeah.
I'll get to you.
Does any of this work with an HSA?
No. HSAs are only for individual and group plans. And since you brought it up, so the question was, the Medicare plans or Medicare work with HSAs. You could always withdraw funds to pay for your medical expenses. And here's a thing to remember. It was supposed to be passed this year. It looks like it might be pushed off for another year. Once you get Medicare, doesn't matter if it's Part A or B, you cannot make a contribution to an HSA account. You will get penalized by the IRS when you do your taxes. They know it's a ridiculous law and was supposed to change, but I think there's some other more important things they want to do. But once you get Medicare Part A and you have an HSA, you could draw funds from it, but you cannot make a contribution. Be very careful about that. You were next.
Yes, so is the high deductible plan F going away also?
The high deductible, the question is a high deductible F plan going away? Yes, but it will be replaced by a high deductible G plan. And the only difference is you would have to, the out-of-pocket maximum of $2,300 will still be the same, but you would have to pay the Part B deductible sooner of $194. I believe you're a gentleman. I'll get to you. Yes.
So the question or the thing you just said was you can't do HSA. Can your spouse do HSA? Or just, again, if you file joint.
Oh, okay. The question is, well, are you both over 65 on Medicare eligible? Okay. So what happens when you have an HSA? The question is, could your spouse contribute to an HSA if you are not able to? So there is a family contribution to an HSA. Let's say I think it's like $6,550, something like that. She would only be able to pay into it the individual, which is about $3,400 or so. So yes, if she stays on that HSA plan, you come off and get a Medicare plan. Or if you want to stay on that employer plan, but now you have Medicare Part A or Part B, you cannot make the family contribution, but she can make a single contribution. Yes, go ahead.
That's not true.
What?
If both of you are covered, the HSA contribution is made by her as long as the husband and wife are both covered by the plan. The husband cannot have an HSA contribution, but the wife can. And the husband is ineligible, it doesn't matter. So if, as a family, you're covered by an employer plan,
Yes.
and the husband is covered by Medicare and the wife is not, as long as the husband's covered by the medical plan, she can do a family contribution, but put it in her HSA.
What is HSA?
Health savings account. Health savings account. So you're saying if he must stay on that plan, or
Right, I mean, as long as that family coverage, there's no problem. But the HSA contribution must go to her HSA. They cannot contribute from his HSA, just for hers.
right, they could make a contribution for.
Family, as long as you're both
So you're saying he has Medicare Part A and B. Let's say it's a small group, because under 20 employees, you need Medicare Part A and B. He has Medicare. He stays on the group plan. Let's say the employer is paying most of the premium. So he says, it's more advantageous for me to stay on this employer group plan instead of going on to Medicare. He cannot make a contribution to his HSA account, but the spouse can at the family contribution. Okay. I didn't know that. That's good to know. I didn't know that. I thought it was just a single one because that person. Well, you're right. The person's not eligible. She's on the plan. Okay, I will double check, but it sounds pretty good to me. We will actually check that with our compliance officer, but it sounds like that's probably true. You probably looked into it. It sounds like.
I represent the areas.
Okay, great. Next question. HSA, for those that know, it's a health savings account. You can't just have a health savings account unless you have an HSA compatible health insurance plan. Just because your plan might have a high deductible does not make it a HSA compatible plan. How an HSA plan works, there are no benefits until you reach the deductible. And then you set up this savings account, which is a separate part of it, and then you could use the funds in there to pay your medical expenses until you reach your deductible. Yes?
I would just like to add something to what this gentleman said, which is that assuming you have, let's stay with the husband is Medicare eligible, wife is not, if you're in a situation which some of us are...
Excuse me, could you talk into the mic? Because I couldn't repeat this question.
So if you have the situation that he was first talking about, but you also have the situation which some of us do have, which is we still have children who are under the age of 26.
Well, that's a family.
So the husband would not actually need to still be on the plan that the wife and the children are, because the wife still has the family coverage. And she can still put in the HSA, the full HSA.
Because they have it's a
family coverage,
plan.
Even though the husband who is Medicare eligible is not on it.
Right.
So you can the wife can still be doing that.
Correct. You just need two people on that health insurance plan to make the family contribution.
Right.
Correct.
Exactly.
So children qualify for that. It doesn't have to be the spouse. Thank you for that question. So I took one more. Anybody else? Yes, I'm sorry.
You mentioned somebody who was switching from F to N and back. Once you meet the guaranteed acceptance and you've applied for the supplements, can you switch back and forth without underwriting?
So the question is, once you pick a plan, let's say you're new to Medicare and you get a Blue Cross plan, or you get another carrier. Mutual of Omaha has a plan, United Healthcare has a plan, you pick a plan F. Now you want to go to a lower cost plan, or you had the lower cost plan, now you want the other plan. You could switch plans with Blue Cross at any time. That they do not ask medical questions. It's always a guaranteed issue. But let's say you start with Blue Cross and then you find out, hey, this United World, which is a Mutual of Omaha company, has a much lower premium. I want to go there. Well, you can, but you would have to answer medical questions and they could decline you. Another carrier like United Healthcare, they have 3 rate tiers. Depending on your health condition, there's only like 5 knockout if you're on dialysis, cancer, heart problems. They could bump you from 1 rate to number 2 rate, which would be more than probably what you're paying originally. So they're a guaranteed issue. They can't decline you, but they could charge a higher premium for you. Yes?
I wonder if I could go back to the Plan F eligibility. Can you still run in any day between now and December 31st to get a plan?
Okay, so Plan F is not going away for people who are Medicare eligible prior to January 1st, 2020. You could always get F anytime you want in the future. It's just will not be available to anybody who's new to Medicare starting January 1st, 2020.
Okay. So if you're on A or B or A and B right now, you're okay?
You can get a Plan F in the future. So what happens when they get rid of a plan, what happens is now that plan is not getting the younger, healthier people to keep the rate steady. So you'll see higher rate increases on a Plan F compared to the other plans. And they said for sure they're going to be double digits for a Plan F compared to the other plans. And right now it really doesn't make sense because what you're going to be paying extra in premium is going to be more than paying that Part B deductible. One more question, then I'll go. Yes, we'll be talking about the drug plans as well. The question, are we going to go into drug plans? Yes. Because drug plans fall in 2 parts. A drug plan is covered under Medicare Advantage plan, which I will be talking about pretty soon. And then when you get a Medicare supplement, you also would need a standalone drug plan. No. Back in 2006, Medicare supplements no longer offer a plan that offers a drug coverage. It used to be a Plan J. But it's anybody who has that, it's very expensive. Once you had it, you could keep it, but they stopped offering that in 2006. So Medicare supplements, if you have original Medicare on the left, if you just have Medicare Part A and B, Medicare pays at 80%, you would have to pay 20%. Your out-of-pocket maximum could be unlimited. If you get a Medicare supplement, Medicare always pays first. When you get a medical bill, the bill goes right to Medicare. They pay their portion, which is usually 80% after certain deductibles. Now the Medicare supplement will pick up those deductibles, pay the remaining 20%. Then you, the member, which is the insured, pays a fixed premium for that. Now, Part C, these are called Medicare Advantage plans. Throughout the country, they're more popular than the United States. Than Illinois, because the great hospitals we have in the Chicago metro area, they could pick what insurance carriers they want. And they don't want to have, most of them, especially teaching hospitals, do not want to accept Medicare Advantage plans because they accept less payment from a Medicare Advantage plan. So Medicare Advantage plans are provided with from private insurance carriers that contract with Medicare. Medicare pays a monthly fee to the insurance carriers. So how that happens, when you have Medicare Part A and B, and you want a Medicare Advantage plan. Now, the Medicare Advantage plans cover doctors, hospitals, and prescription drugs. Now, Medicare says to United Healthcare that offers Medicare Advantage plans, you take care of the client, and each of these carriers that offer Medicare Advantage plans have star ratings, up to 5 stars. The average is about 3.5 or so. The higher your star rating, the more Medicare will pay them. And Medicare will pay them up to $15,000. They'll say, Medicare will tell United Healthcare, Joe Smith is your responsibility. We will pay you on a monthly basis up to $15,000 a year. And not only that, you'll get to keep the Part B premium. Because right now on the TV, on the radio, you're hearing about these zero premium plans. They're talking about the Medicare Advantage plans. Right now is the annual enrollment, which is October 15th to December 7th. So all these ads with zero premiums, zero copays for doctors, low copays for doctors. That's what they're talking about. And people always ask, how could they offer something for a zero premium? There has to be a catch. Well, the catch is, besides receiving money from Medicare and the Part B premium, there are copays for everything. And even though it may have a zero premium, your maximum out of pocket could be anywhere from $3,400 up to $6,000. So if you do have something major, and the insurance carriers even say if somebody has a chronic condition, do not put them on a Medicare Advantage plan because most likely they're going to hit pretty close to their max out of pocket, where a Medicare supplement might be the better option. And they are network-based. Most are HMOs. Some have PPOs, but it's not a true PPO like your group plan or an individual plan. They're network-based. You must make sure your doctor and hospital's in the network. If you find another doctor, he's not in the network, if you see him, you have to pay for it yourself. They're very restrictive. Yes, sir.
So generally, the Medicare Advantage plans in Illinois and Chicago, the teaching hospitals are not in the network. Is that generally true?
Yeah, I believe that one carrier, I believe Aetna, now has Northwestern. Loyola is in a couple of them. Rush is not. And I think Cigna may have University of Chicago. But you will not find all of the carriers offering all those teaching hospitals. Yes, ma'am.
State of Illinois employer plan created a Medicare Advantage plan. So it's their own plan, but it emulates all the requirements of the ABCDs.
Right. That, yes.
Do you know if the hospital choices under that condition would be more expensive than what you're providing?
So the question was, there's some associations, there's something called group Medicare Advantage plans, which sounds like you're talking about. Sometimes teachers unions offer them, or larger companies. It's called a group Medicare Advantage plan. And they have a premium. And the premium could be quite a bit more than if you get an individual premium. Networks, I'm not sure if they're larger or not. I know a few years ago, the city of Chicago stopped offering health insurance to retired firemen and police, but they offered them a group Medicare Advantage plan. And the premiums I saw, because I talked to a husband and wife, he was on the fireman's plan, it was over $500. He was better off getting a Medicare supplement and a Part D drug plan. He was saving quite a bit of money. With Medicare supplements, your premiums go up based on your age. When you have a group plan, it doesn't matter what your age is. the premiums are the same. So somebody who's 65 is paying quite a bit more than they should, and somebody who's 80 might be paying what they should be paying. It's good to shop and compare the difference between a group Medigap, Medicare Advantage plan and getting it on your own. So the Part C or Medicare Advantage plans combine hospital, doctors, outpatient care, and drug plans all into one. It must be, the basic of a Medicare Advantage plan must be as good as Medicare, and they are. They must cover all the parts of A, B, in most cases Part D. They typically include some other benefits. Sometimes they come with the plan. Sometimes it's an option that you could add to it as well. You will never lose Medicare by joining a Medicare Advantage plan as long as you pay your Medicare Part A and B premium. And some people do pay a Part A premium if they have not worked 10 full years or 40 quarters. Additional Medicare Advantage plan benefits. Some plans include, most plans actually include some type of gym membership. Silver Sneakers is the most popular. You go to places like the YMCA, Lifetime Fitness, Kurz, and more. Sometimes it's a small monthly fee you have to pay. Sometimes it's no cost. They may offer an over-counter benefit per quarter. They may give you $50 of a credit. You could go online and buy some over-the-counter supplies as well. Transportation benefits are, if it's medically necessary and you can't see a doctor or physical therapy, sometimes they provide that as well. Hearing aids, you get a discount on hearing aids. Dental and vision, sometimes the plans include it. The plans that include some of these benefits, there's a premium to it. It would not be a zero premium plan. You could also buy dental and vision standalone. On top of that, there's always a 24-hour nurse hotline. Meal planning, depending on if you're a diabetic, they could help you with that. Disease-specific counseling and care services. The one thing with these Medicare Advantage plans, and they're the ones who started, they do follow up with their members because they want their star rating to be as high as possible. The higher the star rating, the more they get from Medicare. And they do outreach. If they know that you have kidney disease, you're on dialysis, they want to make sure you're taking your medication, or even if you're not on dialysis, they will talk to your doctor, make sure you're taking medication, seeing your doctor, following a diet, because they want to keep you healthy. They rather pay the costs up front, a few $100,000 or $1,000 here, right now instead of tens or $100,000 down the road. So they're the ones who actually started this outreach. They're called case managers who reach out to their members. And now individual and group insurance carriers are reaching out to their members as well because of the skyrocketing cost of medical services is just getting out of control, and so are the premiums. So now they went back, why are our premiums so high? Because the cost of medical care is expensive because a lot of people aren't taking care of themselves or they're not compliant. Well, somebody will reach out to them, talk to them, what's the issue? Could you not afford your medications? We have possibly a plan called low-income subsidy that may help you. So that's the one good thing about Medicare Advantage plans. They started with the case management in the insurance industry. So where does the money go? For every dollar they do collect, Medicare Advantage plans, 87 cents must go to medical care or benefits. Now, Part D or standalone drug plans. If you get a Medicare supplement, Medicare supplements, doesn't matter if F, G, N, it only covers doctors or hospitals. So then you need something to cover your medications. Right now is the annual enrollment to change your drug plan, and every year you should look into to see if you stay on the same drug plan you had last year. Every year the carriers change their formularies, their premiums. So what we do is a drug analysis for our clients to see, hey, I had Cigna last year or WellCare or Aetna, should I change? Well, we do a drug analysis on the Medicare website. We ask for your zip code, a list of your medications with the dosage, and what pharmacy you use. And just because your friend has a Blue Cross, a lot of people say, I want what my friend has, or I want the same plan as my spouse. It really doesn't make sense until we do that drug analysis. And Medicare will show us who's got the best overall cost for you. The Part D drug plans, there's, I believe, 26 carriers in Illinois that offer the plan. And they must offer all this. There's also a standard level of care that they all have to go by. Yes?
How do you make choices for those of
Right, okay. So the question is, if I'm not taking any medication, should I get a drug plan? Or which carrier should I go with? My opinion is, and Franklin Parker is my associate that does a lot of drug analysis, you must get a drug plan even if you're not taking any medications. There's a drug plan out there for $13.20 a month. The reason you want a drug plan, you could not sign up for a drug plan anytime you want. Yes?
That's not what I'm asking. What I'm asking is, how do you choose when you don't have a prescription drug in your regimen?
Right, so if you're not taking any medications, I would say go with the lowest cost plan out there, which is, right now, WellCare has a plan for $13.20. Have something. And their plan, WellCare, is $13.20, but we've been doing a lot of drug analysis, close to 100 so far this year, and they have a large formulary and they're coming up a lot. So we would say start off with that. WellCare, the cheapest, why get a plan for $30 when you get a plan for $13? You may or may not use it. And to go further, once you become Medicare eligible, you only have like 3 months to pick a drug plan. If you don't pick a drug plan within 3 months of becoming Medicare eligible, you can only change or get a plan once a year, which is right now during this time frame, October 15th to December 7th. Past December 7th, you have to wait another year to get it. Not only do you get a 1% penalty per month for not having it, which to me is not that much. The biggest penalty is, because we get calls every year for it, people did not take a drug plan because they said they're not taking any medications, and all of a sudden they just got prescribed an $850 medication. Could I get a drug plan? The answer is no. You're going to have to pay the retail cost. Yes, one more question.
If someone has VA coverage, you know, if they do prescription drugs, what do you have?
Yes, VA. So if somebody has VA coverage, if you're a veteran and you have VA coverage, your drug plan is called TRICARE, which is a great plan. If you have TRICARE, you do not need to get a standalone drug plan. You will not receive a penalty. One more question, yes.
I had heard that actually that aunt didn't get a Part D plan for many years, and then she needed it, and she's being charged a penalty for the rest of her life.
So what happens, yes, so in 2006 is when they came out with a standalone drug plan. You have 3 months to get a Part D drug plan. So this came out in 2006. So the people who were 65 by 2006 are paying a big penalty. It's 1% a month of $35 basically is what your penalty is. So you're talking about, let's say, $4 extra per year you would have to pay on top of whatever your Part B premium is. So let's say you get this WellCare plan. It's $13.20. And now you waited 10 years because you didn't have a drug plan. Well, 10 years, that's an extra $40 they will add on to your premium of $13.20, and that's for the rest of your life. Yes, it is. Prescription drug plans, one of the reasons you need it. 5 out of 6 people over 65 are taking at least one medication, with most older people taking 3 or more. Most Medicare Advantage plans that we offer include a drug plan with it. These are standalone drug plans that you should get when you get a Medicare supplement. There was an IRMA charge for Medicare supplement, which stands for income-related monthly adjustment. I talked about earlier for Medicare Part B. There's also an extra charge you would have to pay based on your income that will be added to your Part D premium. And the income levels are basically the same. It starts off, if your income is filing jointly, $170,000 to $214,000, you may pay $12.40 more. If your income is less than that, you just pay whatever that Part B premium is. Could be $13.20. And for people in high income earners, you might have to pay an extra $70.90 in addition to your Part B premium. And that will be adjusted by Medicare and Social Security when you retire, and they go look back 2 years. I touched on this. This is what that late enrollment penalty is if you do not sign up when you're supposed to. And what I say in here is the big penalty is you don't want to get, the reason you want to have it, you don't want to be surprised when you get prescribed a very expensive medications. And what's happening, you see these commercials for these great commercials, somebody sitting by a lake or whatever. These medications and drugs that are advertised on TV are very expensive. My wife, as an example, is taking one of those medications. It's $3,000. Luckily, if you're not 65, you can work with the pharmaceutical companies. And this is another thing I should mention. You ask, how does somebody afford that? Well, it's $3,000 a month. But if you're not on Medicare, you can work with the pharmaceutical companies, get your doctor involved, and with your insurance carrier. My wife only pays $50. But she was warned, once she goes on Medicare, she loses that subsidy. And she would have to get the Part D drug plan. And with a Part D drug plan, there's different tiers of medication, and then there's different stages of the Part D drug plan. She could be out a maximum of, let's say, $5,000 for the whole year. But it's better than paying $3,000 a month. Yes. I appreciate you using the mic. Thank you.
Can you discuss the various Part D plans that are available in the so-called donut hole?
Okay. So that's the different parts of Medicare. In this presentation, I took out that donut hole because in 2020, technically it's going away. To touch on it briefly, when you sign up for a drug plan, there's different stages. There's your initial, where you're just paying a copay for your medications. So if you're paying $5 for a medication, but the cost of the medication is actually $30, it's the insurance carrier who's paying that balance. So once you and the insurance carrier have paid, let's say, $4,000 towards the cost of your medication, you go into this donut hole. And once you reach that donut hole, the carrier and you have paid $4,000. You may have only paid $700. The carrier picked up the other $3,300. Now you're in this donut hole, and you would have to pay 25% of the cost of that medication. So let's say if it was a $5 copay before, it's a $100 medication. Now you would have to pay 25%. Once you've paid roughly $6,000 out of your pocket, then you pay a maximum of only 5% for the cost of the medication. Does that answer your question? A little bit. The donut hole is the most convoluted, complicated thing they ever came out with, but at least they made it a little bit better for 2020.
Okay, so two questions, follow-up questions from that. The first is, does every Part D prescription drug program that you can purchase work that same way?
Yes,
they all have the donut hole? They all have to
follow the same formula,
okay.
Yes.
Second, you said that technically the donut hole was going away in 2020, and can you tell us what you mean by that?
Well, before it used to be, once you went in the donut hole in years past, it started off where you had to pay 45% and then down to 43%. Now they just said it's a straight 45%. Before there was different percentages of what you paid for brand name drugs compared to generics. You could have paid, let's say 70% for your generic and 45% for your brand. It was very confusing. Now they just said now it's a flat 25% once you reach there. 25. Extra help. They used to be called circuit breakers. Now it's called low income subsidy. In 2012, 36% of the people on a Part D drug plan who are enrolled qualify for a low income subsidy. Nearly 1 in 5 or 20% of the people actually qualify for it but don't even know about it and have not enrolled in a low income subsidy. When you qualify for a low income subsidy, and I'll talk about that in the next couple slides, they may pay your premium. You might have just a flat $2 premium, $2 cost for your medications. Doesn't matter what tier drug it is. There's 5 tiers of medications, anywhere from generics all the way to specialty drugs. When you qualify for low-income subsidy, you'll pay just a flat $2 copay. You have to qualify for low-income subsidy. You must be receiving Medicare. You must have limited resources. Individual, you cannot have more than $13,820. They do not count your car or your home. Married couple, it's $27,600. And then your income, it's above Medicaid levels. You could earn up to $18,000. And then for a married couple, you could earn up to $24,360. So if you know anybody who's struggling with their costs and you know they're only living on their Social Security check, they should look into this. It's through Social Security. You could just go to the Social Security website, and it's a form you just fill out. Within a few weeks, you'll get a purple letter saying that you qualify. But 20% of people qualify and they don't even know about it. Yes, sir.
So is that $18,090 for individuals on top of the Social Security benefits someone's receiving?
No, it's not on top. That's your total income, including it. Yes. Yeah, there's a lot of people just earning $12,000 a year, and that's all their income they have is their Social Security. So there's different times when you can enroll in a Medicare Advantage plan and a PDP, which is a Part D drug plan. The initial enrollment, once you're turning 65, you can apply 3 months prior, the month of, for the Part D, 3 months after your initial enrollment. So if you turn 65 today, you have another 3 months to get a Part D or MAPD. There's a special year-round enrollment period, loss of group coverage, or moving in out of a certain area. If you go to a different county, that's a qualifying event to enroll in it. Then the annual enrollment that we're in right now, October 15th to December 7th. This is the initial coverage. So if your birthday's in June, you can apply for Medicare 3 months prior, the month of, and 3 months after that to enroll in Medicare. In the Medicare Advantage plan. For a special enrollment, here's some qualifying events, moving in or out of a plan area. Definitely if you move into another state, you must get a different Part D drug plan. If you move from Cook County to DuPage County, you must check to make sure that drug plan is available in that county. It could be different, and then that's a qualifying event to enroll in it. If you're gaining or losing Medicaid, that's another qualifying event to enroll. If you qualify for low-income subsidy, you could change drug plans every single month if you wanted to. If your plan was terminated, but the biggest one is losing employer coverage. If you decide to retire or you left a job, that's a qualifying event. And if you were under 65 and disabled at age 48 and now you're 65, that's another qualifying event to enroll. And this just talks about the annual enrollment that's happening right now. The rest of the year, it's called a lock-in period, which means you cannot do anything unless you have a qualifying event. So we're almost done. A couple more slides. The summary, what original Medicare is. Medicare pays 80%. The beneficiary or the member pays 20%. The Part A deductible, it says $1,340, but it's over $1,400 for 2020. So this Part A deductible is not a calendar deductible. It's every time you have to go to the hospital, you would have to pay this if you only had Medicare Part A and B. If you have a Medicare supplement, Plan F, G, or N, it covers that deductible for you. If you only have Medicare Part A and B, your out-of-pocket expense can be unlimited. Part A enrollment, Medicare goes back and forth. What happened is years ago, and up to actually a few years ago, and sometimes Medicare makes a mistake, once you turn 65, they enroll you automatically in Medicare Part A. They'll send you a letter. You're shaking your head no. If you're collecting Social Security, yes. So in years past, though, Medicare would enroll you when you turn 65. They would automatically enroll you in Medicare Part A. Then they realized some people had an HSA plan, and there was an attorney who did file a lawsuit against Medicare, because once you have Medicare Part A, you can't get rid of it. But he filed a lawsuit saying, you enrolled me in Part A. I didn't ask for it. You just enrolled me, and I don't want it. And he won. And that's what Medicare said. You now have to enroll Medicare Part A and B yourself. The only time that they will enroll you in Medicare Part A and B automatically is if you are collecting Social Security benefits. Part B, you need to enroll because they're not sure if you need it. If you have an employer group plan, which is called credible coverage, you may not need Medicare Part B. Part B has a deductible. These are older rates on here. It's going up to over $190 for the deductible, and the premium is $140. You should have a Part D drug plan with a Medicare supplement, and the network is Medicare. Just ask your doctor, you accept Medicare, then the Medicare supplement will have to pay as well. So talk about Medicare supplements, they will cover the 20% that original Medicare does not pay. There's no network restrictions. You don't have to worry. All hospitals accept Medicare. There's doctors who don't accept Medicare. There are a few doctors. There's concierge doctors where you have to pay $3,000 a year to be able to see them. They don't accept Medicare. Just check with your doctor. Most doctors do accept Medicare. You must have Medicare Part A and B for a Medicare supplement, and you should have a Part D drug plan as well. Premiums increase every year based on your age. Sometimes there could be medical underwriting if you've had Medicare Part B more than 6 months, except Blue Cross Blue Shield. There's always a guaranteed issue. And you'll never see a bill as long as it was a Medicare approved expense. It's behind the scenes. They will pay, Medicare will pay the provider, and then your Medicare supplement will pick up their share as well. Medicare Advantage plans, they are also offered by private insurance carriers. They utilize a network, and that's the key. They utilize a network, even though they have zero premiums. There could be out-of-pocket costs. It could be quite a bit, from $34,000 to $6,000. They have best clinical outcomes. You must have Medicare Part A and B. Most include a drug plan. Some people who are on TRICARE, which is the VA benefit, you can't find a plan that's just the MA part, the Medicare Advantage plan, because MAPD stands for Medicare Advantage Part D drug plan. They must cover everything that original Medicare covers. The annual max out-of-pocket from $2,900 to $6,700. That should be $3,400. I haven't seen a plan as low as $2,900 max out-of-pocket. Reasonable co-pays for services, and you could save a significant. This presentation was put together by another associate of mine. He wanted to put this in there. You can save significant amount of money throughout your retirement versus a supplement in original Medicare. It should say if you stay healthy. Because once you get hospitalized, you're going to run through your max out of pocket. It's great if you stay healthy, but you never know. That's it. Questions? Yes.
You talked about the 80/20 payment when it's actually far less that they pay. The issue of doctors having assignment or not accepting assignment, can you explain?
So the question is, Medicare pays 80%, the supplement pays 20%. If a doctor accepts Medicare, they cannot balance bill you. The most a doctor could charge you is 15% more than that. But if you get a plan that covers that excess charge, which I believe Plan G does, you don't have to pay that excess charge. Now, there's a doctor who says, well, I don't accept Medicare, but I'll accept Medicare payment. So let's say the Medicare says for that service, we will pay that doctor $100. But that doctor says, I want $200. If he says, I'll accept payment, I'll take the $100 from Medicare, but I'm going to balance bill you $100. He could do that as well. And that's on a case-by-case basis. Then there's a doctor who might say, I don't accept Medicare at all. Pay me, and then you file a claim with Medicare. And Medicare will reimburse you for the negotiated rate, what that service should have cost. No. You don't have, not all doctors have to accept Medicare. They don't have to. Oh, no. A lot of times you'll see psychologists, mental health. A lot of them don't even, they won't even submit. If you have individual group, they'll say, here's the bill. You pay me, then you get reimbursed. Yes. I'm sorry, I'll get to you. So the question is, if you're covered by an employer group plan and you turn 65, what should you do? The key number here is 20 employees. If there's more than 20 employees, your group plan is the primary, and you don't need Medicare Part A and B. If the group plan is less than 20 employees, Medicare is the primary, and your insurance carrier is the secondary, which means your insurance carrier knows you're on Medicare. They're only going to be paying 20% of your medical bills because they know that Medicare is paying the other 80%. Now, some people are surprised. I never got Medicare Part B. They were paying my doctors. My insurance, Blue Cross, has been paying my doctor bills for a few years. All of a sudden, I'm getting a bill, and I owe 80% of the bill because Blue Cross just found out that they should be the secondary payer. And there's a lot of people walking around who are on a small group, less than 20 employees, that don't have Medicare Part B, who should have Medicare Part B. No, your insurance that you have at the employer will be the primary. Another thing, yes, go ahead. No, not if you're on a group plan, because you would have what's called credible drug coverage. So you will not incur a penalty when you left that company or group plan. You could sign up for a drug plan. You have 2 months from when you lose that employer plan to sign up for a drug plan. Another thing before I get to your question, if you go on COBRA, let's say you leave a firm or your company and you know in 3 months you're getting another job. Once you go on COBRA, it doesn't matter what size your company was. It could be United Airlines. It doesn't matter who it is. Once you go on COBRA, Medicare is the primary. And we had a few situations like that. Somebody came from a grocery chain, an executive, went on COBRA. As an employee, you get COBRA for 18 months. His COBRA is ending. He goes, okay, I need a Medicare plan. All right, what's your Medicare Part A and B effective date? Oh, I never got Part B. Well, luckily, during the 18 months, he didn't have a doctor bill. And now he's one of those people where his COBRA ended in November. He can't just jump on to Medicare Part B. He had to enroll from January 1st to March 31st for July 1st effective date. So he went from November to July 1st without having doctor coverage. It was a scary thing. Luckily, there was no issues. Yes?
Okay, so my question is kind of like the converse of what you just said. If you are covered by a group plan with 20 or more employees, at 65, if you enroll in Part A, does Part A then become your secondary?
Yes. Yes, if you have Part A, and a lot of people get Part A because it doesn't cost them anything, so they enroll in Part A. But you could use it with your group plan. So if there's a gap where the group plan isn't covering certain parts of the hospital, then the Medicare Part A could cover. Yes.
So in the scenario where you work for somebody with less than 20 employees, you turn 65, you go on Medicare Part A and Part B and maybe supplements, does the health insurance premium to the employer decrease?
No, it used to, but not any longer.
Okay, and
Right, Johnny? Yeah, there's no discount any longer, which doesn't make sense because now they're only paying 20%.
similar question.
Yeah.
You're on that plan, the employer health plan with under 20 employees and spouses and children and all of that. And so,
Oh, I'm sorry, let me go back. Maybe I answered you incorrectly. So are you saying the person who was on a group plan, less than 20 employees, he came off the group plan?
yes.
Then his rate may be adjusted then, right?
They wouldn't be paying for that individual's rate any longer. That's because it's calculated just adding the number of employees plus their rate.
Yeah.
And let's say that person has a spouse that's under 65 and needs to maintain that employer coverage.
Yes.
May they do that?
A lot of times, once the employee comes off that plan, let's say he wants to go on Medicare, the spouse has to come off too.
So COBRA, period, or anything like that? Just
COBRA
COBRA.
would be an option, which would be an extension of the employer plan. But then COBRA is the same thing as the employer group plan. You're just paying the full retail cost of that. Yes.
Okay, not to backtrack you, but some employer plans do not allow you to get COBRA once you hit 65 in your Medicare coverage.
For the spouse.
Yeah. No, spouse is 65. So you've got to check with their individual plan.
In most cases, what happens, you're 65, you want to come off the group plan, your spouse is under 65, but you're saving a lot of money because usually if an employer is less than 20 employees, you're paying a good portion of that premium. It's pretty expensive. So you want to come off and go on Medicare because really, when you turn 65 with Medicare Part B, Med Sup, and a Part D might be about $300. So, you might be paying over $1,000. So you want to come off. Now, if the employer or the group plan carrier will not let that spouse stay on that plan, she would come off. She has a qualifying event to get her own individual plan. She could do that. So you have to see which is better. Now, when you have employer group plan, the networks are better. As an example, Northwestern is in a group network, but not on the individual side. So the networks are definitely smaller on the individual basis. You had a question back there? Yes.
You mentioned earlier that your company does a drug analysis for people.
Yeah, so the question is, does our company, IX Health, do drug analysis for people? We do. We do it for people if you buy a Medicare supplement from us. We help you decide which is the best Part D drug plan for you.
Do you help people decide which is the best supplement?
Yes, so, exactly. So everybody's situation is totally different. Please call us. We want to see what your situation is. Sometimes a Medicare Advantage might be better for the person. And with the different plan options with Medicare Supplement, we want to find out your situation. We will tell you this is what a Plan F, G, and N would cost. How's your health? What's your budget? We will make that determination. We're not going to send you an application and say, just sign up for Plan F because it's the most popular. It might not be the best plan for you, and it also depends on your age. If an 80-year-old just retired and wants to, all my friends have a Plan F, I want it. I'll say, are you sure? Because it's going to cost you $2,800 more in premium compared to a high deductible F. And then the worst case scenario, you may have to pay $2,300, and then you're still $500 ahead. So everybody is totally different. Call us, and we will guide you. Pick the right plan for you, be it a Medicare Supplement or a Medicare Advantage plan. Now, for a Part D drug plan, it's a little bit more involved. We do the drug analysis on Medicare.gov with your zip code, pharmacy, and your medications, and it will tell us who's got the best overall cost for that whole year based on the medications you're taking right now. We don't know in the future, what it will be. That's why every year you should do a drug analysis. So once you're a client of ours, you call us, we will do a drug analysis for you and tell you, stay where you're at or switch to another carrier. And we'll show you the printout. Yes. That's a spinner. We gave those out. Take the plastic. It's for people who like to fidget, basically. Just spinning around. Yes. So Medicare. So the question is, are you entitled to ACA preventive? Medicare has their own, where when you're welcome. It's called Welcome to Medicare physical exam. Then once a year, you could have physical exams as well. And testing, cancer screenings, things like that are covered under Medicare, yes. Well, I thank you all for coming. Any questions? Here's the presentation. Here's our contact information, myself, Franklin Parker. Email, call us. I do a lot of this by phone. If you need to meet, we can meet as well. But every case is totally different than your friend or family member. It's unique to you, so please give us a call and we'll guide you. Any other questions, we'll be around here for a while. Thank you.